Thank you very much, Professor Chen, Dr. Sasaki. Before I start, I would like to thank Kyoto University School of Public Health for inviting me here. And today I will be presenting our research findings regarding changes in geographic distribution and patterns of inpatient care in small hospitals in Taiwan from 2004 to 2013. And the second author, Professor Minxin Yang, is also the co-project inspector of my study, and he is also colleagues from Institute of Health Policy and Management. There are four types of major healthcare providers in Taiwan: medical centers, regional hospitals, community hospital, and clinics. And the hospital accreditation is linked to this structure of healthcare systems. And also the payment of health insurance is also linked to this structure. Ideally, community hospitals are tasked with providing primary cares and treating minor diseases and conditions. But under the national health insurance, actually, we do not have gatekeepers, which means patients can receive treatment at any providers they choose. So, as you can see here, at present, medical centers and regional hospitals provide more than 20% of inpatient of ambulatory visits, and more than 80% of inpatient admissions. Okay, so as you can see here, the number of hospitals, especially the small community hospitals, decreased sharply from 1995. At that time, we launched our national health insurance program until 1915. And that led to the situation that community hospitals, they protest against the national health insurance and blaming that the closure of small hospitals is due to the unequal payment in the national health insurance plan. Unfortunately, Taiwan is not the only country in the world which facing this problem, or we say fortunately, so we can share our experience to each other. Okay. As reported by the UK news media, the UK government is discussing to have a budget cut for the national health insurance, and that led to the situation that maybe amount of especially small hospitals in UK will be closed. So same situations happen in the United States, as CNN reported this year in June. The government is talking about the cut of a Medicaid budget. So that might happen that more than 600 hospitals, they are at risk of closure. So it's interesting that find a very similar story here in Japan. We see a decreasing trend in the number of small hospitals in Japan between 1975 and 2010. As you can see here, in 1975, there are more than 2,000 small hospitals with less than 50 beds. But right now, the numbers decreased to less than 1,000. So my research objective is to explore the circular trends and the geographic distribution of inpatient care in small community hospitals between the 10 years. And I employed the data from a National Health Insurance database. And in this study, we include inpatient claims only, and that it's about 26 million of inpatient cases. And also in this study, I exclude psychiatric hospitals and other hospitals that are identified as chronic hospitals. And we define that both closed hospitals or downgraded hospitals, which means the hospitals are no longer accredited as small community hospitals. Then they act like local clinics, which means they provide outpatient visits only. And those hospitals are both classified as a non-existent hospital. And I also want to mention that in this study, we used the U.S. Medical Severity DRG, also known as MSDRG in this study. And we used the version 32, and this is the latest one which supports IC9-CM. And although we use the DRG grouper from the United States, but in this study, we recalibrate the DRG weight with using our cost data. Okay, so it can best reflect the situation in Taiwan. And in our study, we look at two types of outcomes. First one is a geographic distribution. We classify the geographic distribution based on the level of urbanization in terms of high, medium, and low. And we also look at the pattern of inpatient care. Actually, we track three different kinds of indicators. The first one is the number of DRGs, which provide information about the spectrum, the breadth of the spectrum of disease that treated by a single hospital. And we also look at the case mix index. These indicators represent the severity of the average severity of disease treated by single hospital. And we also look at the length of stay, which may reflect the efficiency of hospital care provided by a single hospital. As you can see here, for those acute hospitals, again, the number decreased gradually from 2004 to 2010. As you can see here, and for those hospitals located in low urbanization areas, the numbers dropped from 80 to 59. And for those located in the middle urbanization area, the numbers drop sharply from 214 to 175, which is about 18% of the total hospital located in this area. And if we look at the number of DRGs, as you can see here, I think it's not surprisingly because usually large hospitals provide more comprehensive care, inpatient care. So regional hospitals and medical centers, their patients are covered by more than 500 DRGs. But for those local small hospitals, the numbers of DRGs drop sharply to less than 200. Especially, I want to highlight here, especially for those hospitals located high urbanization areas. The DRGs covered from their cases less than 100. And the trend is a little bit decreasing. And also, if we look at the number of case mix index, it is interesting that for those small hospitals, the CMI, the case mix index, is increasing a little bit. Okay, from by averages from less than 0.8 to more than it's closing to 0.9, and we also observe a decreasing trend from large hospitals. And as you can see here, the distribution of case mix and the volume of care the variation is quite large between small hospitals. And you may also see an outline here, the red dot here at the top center. Actually, this is not a single hospital. It's a combination of 10 regional hospitals. Actually, it's the Taipei Municipal Hospital. A couple of years ago, they tried to merge 10 branches of hospital into a single hospital. And they tried to do that because they want these 10 hospitals to be accredited as medical center. But people was joking that how can you merge 10 high schools to become a university? So, but because they claim their inpatient data directly from only one branch, so the volume will be very huge. Okay. And surprisingly, we find the length of stays grows sharply for those small hospitals. In 2004, it's about 20 days or 30 days. And the numbers in 2013 is about 2 to 3 folds. Okay. So which means those small community hospitals are acting more like chronic hospitals. And as you can see here, the number of DRGs between existing hospitals and non-exist hospitals. Those non-exist hospitals are more like to provide less complexity of diseases, which means the spectrum of disease is shorter than the exist hospitals. Literatures reported there are four forces drive hospital closure. The payment schemes, the economies of scale, the market competitions, and the poor management of the hospital and the consumer preference. In Taiwan, our national health insurance payment is linked to the levels of hospitals. So that's why hospitals in Taiwan, especially for those middle scale and small scale hospitals, they try to expand their scales and get accredited as medical centers. Okay. And that can lead to the consequences that they can get more financial benefit from the national health insurance. And also, for those small hospitals, they suffer from the non-efficiency in the economies of scale and market competitions. And this is especially that because the launch of national health insurance in Taiwan, the insurance will eliminate mostly of the financial barriers for patients to seek health care. So as a patient, they will tend to get treatment from larger hospitals to ensure the quality and outcomes of care. Okay. And those factors are also classified as internal factors and external factors. And interestingly, recently we find some upcoming papers discussing the related topics. For some researchers, they find the closure of hospital may not affect outcomes of acute care. Okay. And there are also a few papers found that the geographic assets do not really suffer significantly if there are only a few hospitals are closed, which means they might not bring any change to the accessibility of health care. Okay. And also, there's a paper report that the impact may differ by the ownership and the location of closed hospitals, which means if there is public hospital closed or if there is a private hospital closed, the impact may be different. So in short, our findings find that a dramatic decrease in the number of those small community hospitals in Taiwan, a dramatic decrease. And those hospitals are becoming increasingly specialized in chronic care. And also, this kind of transformation of small hospitals, they might exacerbate inefficiencies in the delivery of healthcare in Taiwan. And we also want to mention that there's a need to monitor the effect of hospital closure on the access to healthcare and the quality of care and outcomes. I want to thank the Ministry of Science and Technology to support this grant, support this study. We get a grant from the Ministry of Science and Technology. And I also want to thank my research assistant, Ms. Chen, for the administrative support. And as I remember, I'm also required to disclose my contribution to this study. Okay. So actually, provide the concept and to find the findings and do most of the data analysis. So this means I'm a one-man band here for this study. Okay. So thank you for your listening and welcome for your comments and questions. Thank you.